This is Chapter 21, Module 2, Major Arteries and Veins of the Pulmonary and Systemic Circuits. The learning objectives of this module are 1. Identify the major arteries and veins of the pulmonary circuit, and 2. Identify the major arteries and veins of the systemic circuit. Deoxygenated blood arrives at the heart from the systemic circuit. It passes through the right atrium and right ventricle and enters the pulmonary trunk. The pulmonary trunk branches into the pulmonary arteries that take the blood to the lungs. At the lungs, carbon dioxide is removed and oxygen is added. The oxygenated blood returns to the heart and is distributed to the systemic circuit. The pulmonary vessels carry blood from the heart to the lungs and back to the heart again. They include the pulmonary arteries and the pulmonary veins. The pulmonary trunk extends from the right ventricle and branches into the left and right pulmonary arteries. The pulmonary arteries carry the deoxygenated blood from the right ventricle to the lungs. The pulmonary arteries enter the lungs. The right pulmonary artery enters the right lung, and the left pulmonary artery enters the left lung. The pulmonary arteries then branch into the pulmonary arterioles. The pulmonary arterioles branch into capillary networks that surround alveoli, or the small air sacs in the lungs. The capillary networks surround the alveoli and oxygen diffuses from the alveoli into the capillary networks. The capillary networks join together to form venules. The venules join to form 4 pulmonary veins. These pulmonary veins extend to the left side of the heart and empty into the left atrium. Blood from the left atrium flows into the left ventricle and will be ejected into the systemic circuit. The systemic circuit contains 84% of the blood volume. This systemic circuit will supply the entire body, except for the pulmonary circuit. Blood moves from the left ventricle into the ascending aorta, a large systemic artery. At the base of the ascending aorta, smaller coronary arteries will branch to supply the heart tissue itself. The ascending aorta rises from the left ventricle and curves to form the aortic arch, then turns downward to become the descending aorta. There are 3 branches from the aortic arch: the brachiocephalic trunk, the left common carotid artery, and the left subclavian artery. The brachiocephalic trunk branches into the right common carotid artery and the right subclavian artery. Each subclavian artery leaves the thoracic cavity to become the axillary artery in the arm and then becomes the brachial artery more distally. The brachial artery divides near the distal end of the humerus to become the radial artery and the ulnar artery, that then fuse at the wrist to form palmar arches which supply the digital arteries. Each common carotid artery divides into an external carotid artery and an internal carotid artery. The external carotid artery supplies blood to structures of the neck, lower jaw, and face. The internal carotid artery enters the skull and delivers blood to the brain as it divides into 3 branches. The vertebral arteries also supply the brain with blood. They arise from the subclavian arteries, travel through the transverse foramen of the cervical vertebrae, and enter the cranium through the foramen magnum. The right and left vertebral arteries fuse to form the basilar artery, which then branches. An arterial circle called the circle of Willis interconnects the internal carotid arteries and the basilar artery. The descending aorta in the thoracic cavity is known as the thoracic aorta. Branches of the descending aorta supply the organs of the chest and the chest wall. The intercostal arteries supply the chest wall as they extend between the ribs. As the descending aorta pierces through the diaphragm, it becomes the abdominal aorta. The abdominal aorta extends to the most inferior portion of the abdominal cavity, where it divides into the right and left common iliac arteries. As it descends through the abdominal cavity, both unpaired branches and paired branches extend from the aorta. The unpaired branches, meaning only one branch versus a right and a left branch, include major branches to the visceral organs. The paired branches have a right and a left branch that include major branches to the body wall, to the kidneys, to the urinary bladder, and to the structures outside the abdominal pelvic cavity. The first unpaired artery of the abdominal aorta is the celiac trunk. The celiac trunk quickly branches into arteries that supply the liver, stomach, and spleen. 2 other unpaired arteries branching from the abdominal aorta are the superior mesenteric artery and the inferior mesenteric artery. The superior mesenteric artery supplies the pancreas and the right intestinal area, and the inferior mesenteric artery supplies the left intestinal area. The right and left renal arteries are paired arteries that supply the right and left kidneys. The right and left common iliac arteries divide into the internal and external iliac arteries. The external iliac artery pierces through the inguinal ligament and into the thigh to become the femoral artery. The right and left femoral arteries branch to form the deep femoral artery that becomes the popliteal artery posterior to the knee. The posterior popliteal artery branches to form the posterior and anterior tibial arteries. The systemic veins are complementary to the arteries, and the major veins run side by side with the major arteries. Once they start branching, there's more variation. In the neck and limbs, there is one set of deep arteries and two sets of veins, one deep and one superficial. The venous system is noted to control body temperature. The superior vena cava and the inferior vena cava collect all the systemic blood and deliver it to the right atrium. The superior vena cava receives blood from the tissues and organs of the head, neck, chest, shoulders, and upper limbs. We will now discuss how blood drains into the superior vena cava from the head, neck, chest, and upper limbs. Blood from the capillaries in the brain drains into a network of sinuses called the dural sinuses. The great cerebral vein drains into the straight sinus, whereas the other cerebral veins drain into the cavernous sinus. From the sinuses, blood drains into the vertebral veins and the internal jugular veins in the neck. The vertebral veins travel side by side with the vertebral arteries through the transverse foramen of the cervical spine. The internal jugular veins and the vertebral veins drain into the brachiocephalic veins. Another vein called the external jugular vein drains the blood from the more superficial veins of the head and neck and will also drain into the brachiocephalic vein. The right and left brachiocephalic veins merge to form the superior vena cava. From distal veins in the hand, deep palmar veins drain into the right and left radial and ulnar veins, which fuse above the elbow to form the brachial veins. The brachial vein merges with another vein to become the axillary vein. The axillary vein becomes the subclavian vein, and the subclavian veins merge with the external and internal jugular veins to form the brachiocephalic vein. The brachiocephalic vein enters the thoracic cavity. The left and right brachiocephalic veins then merge to form the superior vena cava. The inferior vena cava collects blood from organs inferior to the diaphragm. We will look at the veins that drain into the inferior vena cava, starting with the most distal areas of the body. Starting at the foot, the capillaries drain into a network of plantar veins that supply the arch of the foot and drain into the deep veins of the leg. The anterior tibial vein, the posterior tibial vein, and the fibular vein all join to form the popliteal vein. Another venous network called the dorsal venous arch collects blood from the foot and drains into two superficial veins called the great saphenous vein and the small saphenous vein. The great saphenous vein drains into the femoral vein and the small saphenous vein drains into the popliteal vein. The popliteal vein becomes the femoral vein. Inside the pelvic cavity, the femoral vein becomes the external iliac vein. The right external iliac vein merges with the internal iliac vein to form the right common iliac vein. The left external iliac vein merges with the left internal iliac vein to form the left common iliac vein. The right and left common iliac veins merge to form the inferior vena cava. The abdominal inferior vena cava has several major tributaries, including the hepatic veins. These hepatic veins collect blood from the liver. Nutrient-rich blood from the capillaries of the digestive organs must first be processed in the liver before entering the systemic circulation. Veins surrounding the digestive organs collect blood and deliver it to a vein called the hepatic portal vein that delivers blood to the liver to be processed. Once processed, the blood is collected in the hepatic vein and delivered to the inferior vena cava. This ends Chapter 21, Module 2, Major Arteries and Veins of the Pulmonary and Systemic Circuits.